Hi, this is Marty Stempniak, staff writer for Hospitals and Health Networks. Other industries outside of healthcare, such as racing, fire, police, and aviation, have championed the use of carefully assembled, mission-critical teams to help create an organization of safety and success. Hospitals, such as the MD Anderson Cancer Center in Houston, have also recently looked to use such elite teams in order to provide the safest, highest quality care possible. Today, I'm joined by Dr. Charles Cowles, who is an anesthesiologist and Chief Perioperative Safety Officer at the Anderson Cancer Center. Dr. Cowles, thanks for being with me today.
Thank you very much, Martin.
Could you just start by telling me a little about what a mission-critical team is and how one of these other industries that I mentioned uses them?
Well, when you have high reliable organizations such as fire service, such as like our naval aviators, even car racing, their mission is based upon, and their success is based on preparation, education, and being prepared for whatever situation. They also have to have a considerable amount of flexibility to it. And I think like with healthcare as well, we have a critical mission providing safe care to our patients. Personally, I work in the operating room, and that's a good example of where one could. And so getting everybody to be on board with what task needs to be at hand, how to prepare for emergency, and how to prepare for the unexpected, very important.
Who did you guys choose to be on your team? And could you tell me a little about how it operates?
We actually have most of the folks in the operating room are trained to be, because we can't really segregate out one group of people to be a special team. We have integrated care teams such as neurosurgical, thoracic surgical, and liver teams, which are specialized in knowing the needs of that particular patient. But for the most part, we like to keep it to where one team member could be easily substituted for another.
Could you maybe give me an example of the mission-critical team in action?
Sure. And one thing is that when we look at how standardization and efficiency becomes an issue with healthcare nowadays, and one of the things we do on a standardized basis we like to train into is, for instance, the process preoperatively, when a patient comes to our facility, who is responsible for what particular role with that patient. So whether or not it's who does an assessment, who asks questions, who asks a particular questions, there's no duplicity of effort, but the goal is to where everybody is able to accomplish the mission.
Do you think this approach is easily duplicated at any type of hospital around the country?
I wouldn't necessarily say easily duplicated, but I think with appropriate training, I think it should be duplicated. There's no reason why if a patient comes to an operating room in Houston, Texas, and we have one person assigned to attach an EKG monitor, one person to help the patient move over, one patient to do a timeout, or one team member to do a timeout, then that could be replicated at any hospital in the U.S.
What words of advice or encouragement might you offer to other hospital leaders?
Well, I think one thing that sometimes becomes a difficult sell is the time needed for preparation. And it's going to require a fair amount of time, whether people just simulate and they practice what they do. And no better example of that as there is in crisis situations that occur in the operating room or could even occur in the emergency center. And so I think allowing the time for people that it's kind of a non-revenue time, but it's one that it will be great in preparation for whatever situation, and of course, best for the patient.
Any other things about this that you like to add that we haven't talked about, or other key points?
I think the simulation is an important part, and if you look at even our aviation partners, that they're pilots, they go through a series of simulations, and it's not that they don't know how to fly a particular plane. It's just they never know when they get on a plane when a crisis is going to present. And I think when you deal with patients that are ill, or any type of practice, you have to be prepared as well. And the only preparation you have is to practice, and I think that simulation and standardization is a good approach to that.
Can it be hard to get doctors who are sort of set in their ways to buy into this approach?
It's interesting that when you get them involved in a simulation, we had a simulation where we did an evacuation drill in our operating room. And I engaged one of our neurosurgeons to do that. And what happened during the drill is they went to a set of elevators that they normally don't use for patient care to evacuate. we found out that the bed didn't fit in that particular elevator. And so we came up with a plan on how to identify those elevators. Well, what's interesting is about 2 weeks later, there was an emergency case coming from the emergency department, and where the test was done, used a different set of elevators. It was that same neurosurgeon, and he was able to kind of stop it and say, this won't fit, we need to go to another elevator bank. So in a way, he took the time out of his practice to do it, but the immediate result from that was in a crisis situation, the patient actually gained the benefit.
Dr. Cowles, thanks so much for being with me today.
Thank you, Martin.
For HNHN, this has been Marty Stempniak. Thanks for watching.